The second new grant recipient is Dr. Laura McAdam from Holland Bloorville Kids Rehabilitation Hospital in Toronto. Dr. McAdam will receive $25,000 this year for her project entitled Youth Helping Youth, Dissemination of a User-Informed Bullying Resource for Youth with Duchenne Muscular Dystrophy, focusing on psychosocial well-being and peer support, areas that families consistently tell us matter deeply. Dr. McAdam, over to you.
I'm just going to share my screen. Should be coming up shortly.
Yep, we see it.
Okay, so you're seeing my slides. Perfect.
Yep.
Excellent. So, thank you for the introduction. Similar to Jim Dowling and Hans Lockmuller, I've had a long relationship with Defeat Duchenne Canada, and we were able to participate in the Family Forum this past fall, which was an incredible opportunity to meet individuals across the country as well as continue or having ongoing. Um, Collaboration with Defeat Duchenne Canada. So today I'm going to be talking about youth helping youth. Um, a dissemination of a user-informed bullying resource for youth with Duchenne muscular dystrophy across Canada. So this project is focused on several pillars of the strategic plan for Defeat Duchenne Canada. The original project was grounded in community engagement, and it really started as a discussion in clinic with youth and their families, which grew into a research project, which I'll be highlighting, and which created the foundation for our knowledge translation project, which is the grant that was submitted to Defeat Duchenne Canada. So when we're thinking about bullying, what is bullying? It is an unwanted aggressive behavior that involves an actual or a perceived power imbalance. It's repeated or likely to be repeated and may cause harm or distress to the victim. We know youth with disabilities are 1.5 times more likely to be bullied compared to youth without a disability. And for the initial project, we didn't know what that meant from a rate perspective. There are many different types of bullying, and it can include physical, verbal, social, or cyberbullying. So in the initial study, this was done in collaboration with Hans Lockmuller and Hugh McMillan with CHEO, and we surveyed individuals with multiple types of neuromuscular conditions, but the majority had Duchenne muscular dystrophy. We then offered for these individuals to participate in an interview to let us know about their experiences, and this led to the creation of a resource, which is the foundation for this project. So one of the questions we asked was, in my life, was how have they been bullied? So what the youth told us is, in my life, I've been bullied a lot. So 83% of the respondents experienced bullying at some point in time in their life. When we asked about the individual types of bullying, none of them expressed cyberbullying, but 30% described physical bullying, 88% described verbal bullying, and 83% described social bullying. So this is a very significant issue that the youth with Duchenne are facing. When they were telling us about their experiences, they talked about in my life, they've been bullied for many different reasons. And so disability was one of their most common reasons. So 63% identified that their disability was the root issue from bullying, and 54% discussed appearance. And when we were asking questions in the interview, they were talking about weight. They were talking about the distribution of weight as common changes in their appearance that was a target of being bullied. Additionally, their height. So 86% told us that bullying was a big deal for them and we needed to be doing something clinically. 90% identified it's the bully's fault. So when we're thinking about our target audience, that's important. 73%, when they were telling us what may be helpful, they talked about anonymous phone lines to report bullying. And 69% felt that having parents, students, and staff talking about these solutions would be helpful. In the interviews, several themes came up. And so the first one was talking about individuals experiencing stigma-based bullying. So one of the quotes from the participant said is, "If I can walk, why am I in a wheelchair?" So they were just laughing at that at the time, as if I'm at the all the time if I'm in a new class. So they're really highlighting a new peer group and not really understanding why sometimes they're in a wheelchair and why they aren't in a wheelchair. Now, stigma-based bullying is really the intersection between bullying, which is that intentional, targeted, repetitive behavior, and discrimination. And so in this circumstance, it's discrimination because of the physical condition that they have. They also talk about, a key theme was the resilience that the individuals had when they were telling us about their experiences. So one said, "I basically just talked about it with my parents, and I tried to find a solution on my own because I don't like asking people to help me to do things." So talking about the independence piece, coming up with solutions. So if I find a solution by myself, good for me. So really taking pride in that. And this is just one of the many quotes talking about resilience. They also identified personal and theoretical, helpful and unhelpful supports. So what was helpful was I talked to my mom and my friends, and they're really supportive, which helped me with the bullying. And unhelpful supports. You know, it's very often nobody's around us during school. So it's nobody that can notice the bullying that they're experiencing. So really highlighting that there isn't going to be a single prong when we're looking at addressing bullying for these individuals with neuromuscular conditions. They also talked about bullying interventions. So both through the qualitative and the quantitative part of this study, we've come up with a bullying resource that's informed by the voices of youth with Duchenne and other neuromuscular conditions, as well as their parents. And these grouped into several different recommendations. So focusing on youth, focusing on families, focusing on clinicians, and focusing on schools. And when this resource was developed, we had input from both youth, the parents, and healthcare providers and teachers to ensure that what we saw in the study also resonated with the individuals when the information was being reflected back to them. So this project is looking at the implementation of this resource. So this is knowledge translation, so very different than the basic science that we've heard about. And it's really about helping individuals where they're at, ensuring they have the information that will be helpful for them. So this is a 4-step project over the next year. We're going to prepare the resource for dissemination. So we need to make sure it's accessible in a language standpoint, in a format standpoint. It's going to be translated into French, and it's going to be compliant with the Accessibility for Ontarians Disability Act. Once that has been completed, we're going to use a knowledge translation or knowledge implementation framework called PRISM. And using this framework, we're going to be developing a dissemination plan, an implementation plan, and then disseminating this resource. And at the end of this implementation science framework, they use the RE-AIM framework, and this is evaluating the resource reach and impact from a scientific standpoint. So for this project to move forward, we had engagement of youth and families with neuromuscular conditions to understand the scope of the issue and to develop a resource. And now I'm looking for engagement across Canada for both, once again, for individuals that have Duchenne muscular dystrophy, their families, advocacy organizations, as well as neuromuscular clinics to provide feedback on this resource, establish facilitators and barriers to implementation, draft and improve the implementation plan, and provide feedback of this implementation plan. So if there's anyone on this call that is interested, please feel free to reach out to me. My email is at the bottom here. My email is also on the website for Holland Blue Review. I would love to hear from you. It can be anything from an email communication or participating in focus groups to help move this forward to ensure that this information is widely available across Canada as well as for people internationally. So I would like to finish up by thanking Defeat Duchenne for considering this project, recognizing that it's not a basic science project, but it's a knowledge translation project. And really, we've heard from youth and families with Duchenne about this issue and that it's a significant issue. We've created resources with their ideas, and now we want to ensure that individuals across Canada have access to the information. So thank you so much.
Thank you, Dr. McAdam. There is a question for you. I really like the holistic approach to the resources. Will the resources share scenarios and tactics to approach? Will there be any video assets?
So for this project, um, we haven't asked for specific funding for video, but I think that is an excellent idea for the next phase. There are scenarios based within this resource, and they have many practical ideas. I think no resource when we're focusing in on bullying is going to have all the different ideas, but I think if it could be idea generating and in collaboration with family members and schools to come up with what the right solution is for the individual that's experiencing bullying. But if you would like to be part of this or hear more about it, please reach out to me and I can absolutely find time or share further information.
Great. One more. Can you tell us more about PRISM? How will you collect data on the resources' usefulness to each target audience?
Yeah, absolutely. So PRISM is really a framework when we're looking at barriers and facilitators for implementing this across Canada. And that's why I need a broad focus group to be able to identify, because I think there are going to be different challenges in different places or different areas of the country. Now, when we're looking at evaluation using the RE-AIM framework, on all of these resources, we are going to have a specific QR code that people can scan and give us direct feedback. And we're also able to look at number of downloads from our website, as well as if there are clinics that agree to share this resource, they can let. I don't know, I was muted. Hopefully people heard me when I was speaking.
I think we lost you there for a bit.
Um, there are several using the RE-AIM network, or sorry, the RE-AIM framework, as well as collaboration with clinics disseminating the information. We'll be able to understand the number of downloads from websites, the number of the number of resources that have been provided, but we also want to hear information for people who have been using these resources. So there'll be a QR code where people will be able to provide their feedback. And I think when we're thinking about KT, there are always these cycles. So if we're hearing important feedback, we'll be able to adapt it within the resource.
The question is, are you looking to create a resource that is standardized throughout Canada?
Yeah, so this is a resource that will be available for all across Canada. The resource is informed from the initial research study, so we have a good framework, but I'm really looking for engagement across Canada to review the resource. If there are any ideas to make it more relevant for different regions of Canada, I would love to have that feedback.